Good afternoon, everybody. Welcome to today's webinar. We're doing Getting Started with Ardens Clinical for SystmOne practices. And I'm Nathan. I'm the training specialist lead for Ardens SystmOne. So I'm just kind of going through this. It is just me today doing this, and I'll talk about kind of housekeeping in a minute. But just so you know, with regards to these webinars, I don't know if I've got it on my list. Let me just check because I've got the learning outcomes. But basically, with these webinars, everything's kind of your cameras are switched off and your microphones are switched off. But if anyone has any questions at all, there is the Q&A button. I think it's either down the side or across the top. If you click that Q&A button, you will be able to put stuff in there. I will keep an eye on it. As I say, it's just me. Usually, sometimes we have more people, then I have someone else manning that, but I will look at those as we go along. So if you do have any questions, then just put them in there and I'll answer when I can. It should take about an hour this webinar. So and essentially what we are doing is we are looking at, it's almost like a demonstration of what Ardens Clinical is. So I'm going to be covering a few various things. So kind of awareness of what the resources are, and then kind of looking at the specific kind of data entry templates, where you find them and how you use them, and then a few of the other things, kind of like the drug monitoring, the patient status alerts, and things like your referral forms as well, if you use those in your area. So if you're on Ardens Pro, where you find those, again, I will show you when we get to that. And then a look at some of the reports as well. So we'll start on the templates and kind of where you find them, and then we'll jump into the reports. But as I say, these sessions are they're kind of aimed at everyone. So we're going to be giving an overview of everything. We do specific webinars where we will kind of go into more details for like GPs or admin staff. So there are separate, and at the end I'll give you a link as well to where you can find more information and videos and recordings of those. But the idea of this session is just that kind of broad overview of all of the resources, and we won't be going into loads of detail on everything, but hopefully you'll get a good idea of what's there and you can go in and have a play. So those are our learning outcomes today with regards to that. So just kind of moving on from there then. I'm sure you probably all know who we are, but obviously at Ardens, it's kind of a new kind of strapline for our vision. So it's for all healthcare decisions to be made using the best information, and making sure that everyone at the GP practices have access to relevant, concise, up-to-date, accurate and standardized data. So the idea is, we're doing all the legwork in the background. All the templates have everything you need, all based on kind of best practice and NICE guidance. So then if you're using the template, you can kind of know that's kind of the up-to-date version, and you'll kind of, you don't have to go scrabbling around looking for what's the latest guidance. That's what we do for you. So that's kind of our vision. Again, some of you might already know this, but essentially we've got two products. I'm mainly looking at obviously the clinical side today. So we've got Ardens Clinical, but we've also, you might have heard, we've got Ardens Manager. So Ardens Clinical are kind of clinical decision support tools, the templates, everything that, and again, that's the overview I'm going to give you today. But we do have Ardens Manager, which is our population health management tool. What that does is it takes the data out of SystmOne and EMIS, if you're an EMIS user, because we're looking at SystmOne today. But it takes out both, and then it puts it into a kind of dashboard online that you can log into, and it kind of, you can start looking at all your data and outcomes and things like that. So it's two separate things, but today we're looking at the clinical side. And again, you probably all know this, but the clinical side, that is those templates, the safety alerts, recourse, like for the long-term conditions and things like that, the data quality reports, you've got the referral forms as well, and we do other things like local contracts and national contracts, so that's all kind of built into it as well. But it is all of those kind of resources in your clinical system for you to use, and make sure that you're accurately collecting that data and recording it on the patient record. And then again, like I said as well, just a quick overview of what the Ardens Manager is. So that's kind of automatically uploading that data out of your clinical system. And it's basically all to do with kind of benchmarking and look at trends and targets. Really good, like across a PCN or an ICB. And some practices kind of find it really useful as well. Not really going to be covering a lot of this today because this session is on the clinical side, but it is just worth knowing that that is there as well. And I think we've got a couple of webinars. Again, at the end, I will give you the link to where all the webinars are and any upcoming ones. And you know, say we do different sessions and all the different things. So I think, oh yeah, and then just a quick overview of us. So, you know, we've got over 5,400 GP practices using Ardens now, and that's over 1,300 primary care networks. And we've grown a lot. I think when I started, you know, we were probably, there was probably about 10, 15 people working there. So there's 140 now dedicated staff, and across kind of, you know, clinical and manager. So, you know, we kind of used in a lot, you know, most places now as well. So, I'm going to come out of this thing because I didn't want to do too much on the PowerPoint slides. Just want to kind of give you a brief overview for those that didn't know who we were. And I'm going to dive into my SystmOne. So basically, like I said at the start, what I want to do is give you a good overview of kind of what are the resources, where are they, where do you find them, and just kind of like an overview of what the templates look like and how you could start using them. So I've got my test patient open. When you turn Ardens on, essentially what you're doing is you're joining the organization group in SystmOne that we own called Ardens, and that is where we develop all of the templates and the reports. So you, as soon as you join that group, you have instant access to all of our resources. We don't affect your toolbar or clinical tree in any way. That would vary from practice to practice. I appreciate you're all at different kind of practices. So your tree might look a bit different. Your toolbar might look a bit different. That's fine. That we don't have any say on that. When you can add the templates to those things if you wanted to, but that's kind of a local thing. Where you find them when you turn them on, there's a few different places. Now, the first place to kind of show you, and this is even though I'm using a GP surgery here and yours might be different, the resources and how you find them is the same. So I've got my patient open. Obviously, I'm using a test patient. I can see their name and address. And under that, you've got all of those icons. And you're probably used to that using SystmOne. You've got those patient status alerts. Some of you might not have ever noticed them before. Some of you might have noticed them all the time. Again, everyone's different. But what those icons are doing is they're actually pulling data from the patient record, and they are showing you what's going on with that patient. So, for example, this patient, again, it's a test patient, but they've got like the blue inhaler. That blue inhaler is in there because they've actually already got a diagnosis of asthma. Now, it doesn't matter how that was recorded. If it was on an Ardens resource or just if someone just put the code in of asthma, it's going to pull that through. Now, SystmOne's always had an icon for that. All we've done is kind of replace the generic SystmOne icons, even though it's the same icon, but they're kind of like our icons now, because what happens is if you clicked on that icon, it would open up the Ardens asthma template. And it's the same for like the D. So that D is there if I hover over my mouse. If you're not sure what the icons are, because sometimes you might think, well, you know, what is that? I mean, D is obvious for diabetes, really. But if you weren't sure, you can just hover over and it will tell you. So you can see there, they've got a diagnosis of diabetes and when it was recorded. And again, if I clicked on that D, it would open up the Ardens template, clinical template, that has everything to do with diabetes. So it's a really easy way of getting to where you need to go with your each patient, because those icons are going to change depending on the patient and what they've got. So that's the first place to kind of draw your attention to. I will kind of dive into these in a minute. Some patients have like the red circles. Those red circles are basically telling me that they're on a like they need they're on a high risk drug, and you know, to kind of do a drug monitoring. So in this case, that's HRT, DOAC, and steroids. So again, whatever's in the patient record, every patient's going to have different icons up there. Some will have lots, some won't, but that's a good place to start. And a couple of other things. There's a doctor's bag, which is a really useful one to know for any GPs, because the doctor's bag is kind of where you can do like your general consultation. And then the orange arrow at the end. Again, this depends if you've got Ardens Pro. So if you have an orange arrow up there, that means that you have access to all of the local referral forms that we manage for you. If you don't have it up there, it means you've got I've got starter or plus Ardens, which means that you probably do your referral forms another way, not using Ardens. And again, that's fine. So not all of you will have that orange arrow, but everyone will have all the other icons. And then just a couple other kind of patient status alerts. You get like the green needles. So for example, that green needle there is telling me if I hover over that, this patient's actually eligible for flu. And we've actually got reports that we've built in the background that enable you to identify exactly who needs flu. And you can basically access those templates from the icon to give flu, but also use the reports in the background to send invites out. And I will show you that. I did talk about looking at kind of like the reporting element of Ardens. I will show you where those reports live, but the reports will then affect those icons there. So yeah, that's the first place to kind of talk about. Now, obviously, those icons, it's not going to be everything. That's only what the patient's got, but there might be other things you need to access. Where's everything else? So it's a couple of ways to see everything. One would be here where you've got the auto consultation button. So you should all have that icon up there. Some of you again might not have ever clicked on this. If you're not a GP or you don't see patients, you might not have ever clicked on this. Some of you might use it all the time, but if I click on this, then you get a drop down. Now you might have your own stuff there, but anything with a prefix of Ardens is where all of our templates live. And I liken this to like your index or directory of everything that we offer. So you've got Ardens conditions, cancer, for example, and there's all of the different cancer templates, or cardiovascular, or dermatology. So I think if I was a clinician and I only had 10 minutes, I probably don't want to be, I mean, I could, but it might be a bit a longer winded way of finding what you want. If you think of having a big encyclopedia and you're going to put bookmarks in, but this is like your A to Z at the back where you can just see what's there. So if you want to have a browse and, again, the whole point is just give you that overview. You can go away and have a play. This is a good place to just see what is there. It might be, what sorts of infections templates have we got. Just go to the infections one and you can see all of the various templates and click into them to see what they look like and use them as well if you wanted to. So and then just one other thing on there, you've got kind of like your IMS and injections. So there's all your IMS and injection templates, and then you've got under that your nurses and HCAs as well. So again, a lot of stuff on there, anything from antenatal advice to blood pressure monitoring to smears to injections, ECGs, anything at all, that treatment room stuff. You can see there's literally a template for everything where we can record that data correctly. And the last place, which is a good place to go, is using like the F12 key. So again, some of you might know this, some of you might not. But if I press the F12 key on my keyboard, it's basically a bit of SystmOne functionality that's always existed. If you press F12, you'll get something like this come up, which is called the launcher. And basically on the right hand side here is every single template that lives in the system. Not just Ardens, literally everything. If you've got your own templates, you can search for them there as well. But what you can do here is in that search box, you can basically type the name of a template that you think would be useful. So, if I work on reception, I could type reception in and click search, and then it's found the reception administration template. Or I don't know, if I do ECGs, if I type ECG and click search, then it's found an ECG. Bridget is like the mobile work. I think it's basically like a handheld like SystmOne thing. So we've actually developed a template for using on there, but for now ignore that. We've just got ECG, and then that would be the template. If you get a few of those up, if you say you had about 4 templates called ECG and you weren't sure is one of them Ardens, is one that we've created and we've called it ECG. One way to tell who built that template would be there's a little icon to the right of where it says ECG. If you hover over that icon, can you see it now says Ardens Limited? So we know that's an Ardens template. So just a little trick, tip, if you're ever searching and you've got lots of versions, hover over that and it will tell you if it's an Ardens one or not. And again, all I'd need to do then is what I could do is as well, click and drag that over and I can store it on my left-hand side. And that left-hand side is a list of my own personal favorites that that's just for your login. So you can all basically create your own list of things there if you wanted to, which is again quite useful. So yeah. Just again, I think, to be honest, if I was using this every day, I'd like in clinics, I would use my F12 and I'd just have everything I do on the left hand side. So just remember that, because again, it's the easiest way of finding the templates, because then what you do is double click and it opens. So that's the main ways. You've got the icons, auto consultation, and then F12. So what I want to do is actually dive into a template. So this is when it gets a bit, I'll kind of give you an overview of these, and I'll kind of give you an example of like a GP template. Then I'll go into like a nurse, like chronic disease review template, show you some of the, maybe anything else, like maybe one of the other like injections ones. I'll just view like bits and bobs, and just so you can see how they flow. And then what I might do is actually show you the specific QOF templates, just that have the QOF codes and the contracts and things, and again, which is quite useful. But I think the first place I'm going to start is looking at kind of like a general consultation if I was a GP. So again, if I was a GP, I'm probably filling out these boxes like your history, your examination, your diagnosis, and your plan. And I might be using that day in, day out. What we've done is we've built a template, and it's called the general consultation template, and this allows you to record data in a consultation, but it has loads of links to resources at your fingertips, rather than just in this essence, this is like a blank piece of paper that I would write in. So rather than using those, what I could do is, and again, this is my example now, would be more for like acute stuff. So I think if I start there, so general consultation is your headaches, your bad backs, your sore throats, it's that sort of stuff. So I don't know if you remember, I said at the start, you've got this little doctor's bag up here, and it's called general consultation. That icon is on every single patient. And the good thing is it's contextual. So if I clicked on it for this patient, it would bring up the female general consultation because I'm in a woman's notes. If I was in a child, it would bring up like a pediatric consultation, etc. So again, it is quite clever in that it does that for you. But if I click the icon, what we're going to do is we're going to get up, like I said, it's an easy way of getting up the templates. Now, this sometimes, there's a logic to the way the templates flow, and kind of the whole point hopefully this session is just to show you, like, get your eye in with like, this is the format, this is what it looks like. So with regards to this, you might think, well, there's a lot there, but if you actually look at the bare bones of this, you've got a history box, which is like the box behind, examination, diagnosis, plan. So really you're just writing stuff in there like you normally are. The difference here is we've got buttons that do other things. So you've got like your vitals and lifestyle, your news score, you've got links to other scores or phlebotomy, or maybe we want to access some leaflets or from formularies. So the buttons are there for a reason. So again, and everything kind of flows from kind of top to bottom. Again, I don't want to, we go into more detail with these when we do like the GP set, getting started for GPs. So I don't want to spend loads on this, but I just want to get you kind of know it's there. And then what I'd say is you've got across the top different tabs depending on, general's all very well and good, but it is just general. So you've got things like a breast consultation or cardiovascular or respiratory or dermatology. So again, you can go to the different pages depending on what it is that you need to do. So again, I won't go for every option now, but you've got like the ENT tab, and what the ENT tab, patients come in with a sore throat, something like that. So we could go straight to here to do our consultation. So just very quickly, I'll just show you quickly how to do this. History is free text. SOS examination, so that's great, you can just put what you like in. We have put some standardized presets, so there is a button to the right which is a bit of paper with a green plus. If you click on that, you've got specific things like, okay, it's the most standard stuff, patient's got a cough and a sore throat, so it's the sort of things we'd be looking for. Click OK, and then it goes in. Likewise for examination, yeah, you can write what you like, but if you click your preset button to the right, then we could, inflamed throat, lymph gland swollen, and again, click OK, so it'll go in nice and easy. And it's just, you're just building up a narrative. You can write whatever you like in there, to be honest. But it's kind of standardizing everything in the same way. Then what we've got is we've got boxes to quickly record your numerics. So your temperatures, your SATs, your blood pressures. And again, this will change depending on the tab. So for this one, these are the most probably obvious ones I'd be recording. And, literally just type in, and that codes it. So you don't have to worry about what the code is. We've done that for you. You're just putting it in so you can kind of move on quicker. Each one of these boxes as well, if I click in it, and it's the same across all of the templates. If you click in a box on the right hand side, you've got the previous values. So you can see if any trends, everything's going up, down, when was it last recorded. It's not just for numerics, it's for codes as well. So, were they given any of these diagnosis codes before? It will be all relative to the box So yeah, that allows you to do all that. Again, I'm not going through every option here, but you've got things like scores. So it might be they've done that and they're probably saying, I want my antibiotics. You've got stuff like your fever pain. And if I click that, then I've basically got the ability to use our, fever pain centaur or the modified centaur. So again, whatever one you use. And, we could basically ask them these questions. And it's basically going to give us a score. So again, it's sort of stuff that if I was a GP, I'd probably know that they don't need antibiotics, but I can evidence that in the notes very quickly and easily. And even I would be able to understand if I need to give someone someone antibiotics or not. And I'm not a clinician, but the template kind of enables me to kind of make that informed decision and also record it on the patient record in a really easy way. So you've got that kind of fail safe and that kind of audit trail on the patient record. So that allows you to do that. You've also got a link to that you've done that. Maybe you want to check bloods. So again, you've got this phlebotomy button here. And rather than having to come out of the template, this will just show us any bloods that are previously recorded in the notes. And there is I can access ICE from there as well. So I can then launch ICE to do my bloods. So again, just flows quite nicely. And then diagnosis. So before you might have to bring up your code browser and type and search through hundreds of codes. We've done the most logical A to Z ENT diagnosis codes here. So if I start typing SO for sore throat or TO for tonsillitis, that's going to go in and that's going to code that as the diagnosis. If the code isn't there, you can still get to your code browser by clicking that button, but SystmOne Hub doesn't the other, but it might just be quicker rather than you having to search for everything. It'll just be on that drop down. And then management, you kind of see what's happened here. You've done your assessment, we've diagnosed them, and now we're going to tell them what to do. So in the plan, we can write what we like, but if you click the preset button to the right, we could do things like antibiotic advice. It's unlikely to significantly improve recovery. You've got a throat infection, get some self-care over the counter drugs, etc. So you can select those two. SystmOne to write it, and then under there you've got other links, your leaflets or formularies. So just very quickly, if I wanted to, I could click leaflets, and then I've basically got a link to all of the various ENT leaflets, so I don't have to go searching for them. And it might be something about, I don't know, sore throats, and if I click the link, that will basically open up in my web browser. But to make it easier, you can highlight the link by dragging your mouse over it, clicking and dragging. And then if I right click and copy, I could paste that into AccuRx or use SystmOne to text that to them. So again, it's completely up to you, but that allows you to do that. So you've got all of those things at your fingertips. And then just lastly on here, you've then got your formularies. So, medication, let's do, actually, let's just say they do need something for their sore throat. So we've got the sore throat button there, and then essentially it's telling me exactly what I'd prescribe. So in this instance, first choice is penicillin, second choice is that, but if they're pregnant, we give them that. This box at the bottom will show me any allergies, medication, etc. that they're on. So again, it just works quite nicely because I can see actually they're already on this. So let's right click and issue. So we can do that from there as well if we want to. Or let's just give them penicillin. So if I click that, it will then basically run a little protocol in the background, and it will tell me, right, if you're giving that 12, and it's giving me, the guidance on what I should be giving them. And then I basically just press any of those, and whichever one I click on will prescribe that drug. So again, it works really, really kind of nicely. I've got a good idea of what I would prescribe for different conditions using these templates. So that was at the bottom there. And you've got different formularies. I was just doing sore throat, but there's other ones. And then the very lastly, you got the referral criteria. So if you did all that and you were a bit worried about, I might need to refer them for this because their tonsillitis is the 5th time or 6th time they've had tonsillitis. What's the criteria? Or maybe you're worried about cancer or something. Again, the referral criteria button at the bottom, if I click that, will bring up the ENT referral criteria. And because again, that's the tab that we're on. And you can see, is it tonsillitis, vertigo, or is it just cancer that I want to know the criteria for? So if I click that, then it basically shows me the criteria for someone over 45 because it's worked out that's how old the patient is. And again, it's giving me the what I should be looking for. So do they have any of these things, unexplained neck lump or, lip lump consistent with oral cancer or red white patch consistent, I can't say these words, but you could, and if I tick any of those, it's now telling me that possibly is ENT head and neck cancer. So let's explain that to them. Let's get the referral done. So again, it works. It's there if you need it. I hope that makes sense. Obviously, do put anything in the Q&A if there's any questions on that. There are, as I said, the tabs across the top. If I went to like the respiratory tab, you can see how it flows the same way. You've got your assessment, everything's in the same order. It's just tailored slightly for that condition that you're looking at. So again, formularies in the right place, leaflets in the same place, the scores in the same place, but they're relevant for, in this case, respiratory. We've got the asthma that's another thing actually, the asthma formulary here. This can be localized as well. So depending on which bit of Ardens you've got, this is possible. So this brings up the formulary for asthma. If I choose NICE guidance, it gives me what the NICE guidance is, which was updated fairly recently. And if I choose, I don't know, air, and it shows me exactly, again, what to prescribe, pictures of them. If I go tabs across the top, you've actually grayed out, means that it's not on my local formulary. So that might vary from area to area, but it is possible for these things to be localized. So again, it's just another good shout. You're not having to worry about prescribing outside of the local formulary. The templates will kind of build that into it if we've got that information and that's set up at your end. That can do that as well. So that's the doctor's bag really. Again, that was kind of a quick overview. As I say, we go into more detail when we do the GP session, but it's a good place to start. I think off the back of that, because I talked about referrals, what I'd like to do is I'll just show you kind of where you can do a referral. So let's just say we did that consultation and then we need to access what referral letters we've got. There, remember I said at the start, it's the orange arrow under the patient's name in the top right. The orange arrow, if you don't have the orange arrow, like I said, some of you might not have it. It depends if you've got Ardens Pro. So if you don't, you will probably do your referral forms another way. So please, if you don't have it up there, it just means you do it another way. For those that do, I'll just quickly show you. So if you click the orange arrow, I think my patient's, he's based kind of Salisbury, kind of Wiltshire way. So that's why it's giving me these options. But if you click that orange arrow, it will give you the guidance or the referral forms for the area that you're in automatically. I appreciate you're all at different areas, so it does depend. But if we went, I don't know, let's look at the Bath one. So Bath and North East Somerset. In this case, some of you won't get that question. It will just come up with a template like this. And then what we've got is we've got all of the referral forms for the area that you're in. So even if you're not in this area, the templates all look the same. The slight differences, but the format's the same. So we could then go either the tab at the top or click suspected cancer. And then there are all of the local referral forms or, cancer referral forms. For the area, Bath or whichever one. And if I click on any of them, it's going to open up in Word a referral form that I can then do as I normally do. So again, it's just really easy if you've got those up-to-date forms at your fingertips. And just across the top, you've got other tabs. So for example, you've got like your community tabs. So everything else, there's a tab for your cancer stuff. There will be tabs for your diabetes referrals or elderly care, dermatology, everything. And let's just say every area is slightly different, but they will look similar. You go to the same place and you just have a browse and those are all of your referral forms in one place. So really, if you don't remember anything, you don't have to really remember the specifics of what's on the template for now. It's more just knowing doctor's bag if you want to do a general consultation, orange arrow if you want to find your referral forms. And again, that's for GPs or secretaries. You can get to that orange arrow to get to those referral forms. So hopefully it kind of makes sense. So moving on, because I appreciate I'm kind of covering all sorts, but I wanted to do, so we've done a general consultation. I just wanted to show you like a chronic disease template now. So maybe like asthma or something like that, because again, this is more for, we've done your acute stuff. This is your long-term conditions. Let's kind of, let's do an asthma review or something. So the easiest way, if you just want to get to the template, I know they've got asthma because if you remember at the start, they've got that blue inhaler under their name because they've got that diagnosis. If I click on that, it's going to bring up our asthma adult template. And this template has everything I need to do anything to do with asthma. And again, it depends on your role. Some of you will be doing reviews, some of you doing exercise, so it's all different. I imagine most people going in here a lot of the time will be doing the review. But I just want to quickly give you an overview of what this template and how it works. So all of the chronic disease templates flow the same way. You get that front screen where it's showing you when they were when they were diagnosed with what they've got, when their last review was, stuff. It's codes that are already been coded for that patient. Care plan was done that date. What respiratory meds are they taking? So again, my test patient's not the best example, but you can get a snapshot of what's currently going on with that patient on that front screen. Then going across the top, you've got different tabs for different things. So for example, diagnosis. So obviously this patient already has a diagnosis, but if they didn't, you could bring this template up and you could use this template to diagnose them with whatever it is that they've got. So in this case, asthma. So what it's actually doing is it's giving me the relevant codes and the things that I need to be coding to then say they've got asthma. So, we would say they've got symptoms suggestive of asthma, and then it says, and one of the following objective tests need to be done. So again, and now you might wonder what the red stars are. The red stars are QOF codes. So across the board, and this will make more sense on the review page, if you see a red star, it means it's capturing a QOF code to make sure that you capture your QOF for the year and get paid, basically. So in the case of this, I think as part of a diagnosis of asthma, one of these codes has to be added to make sure that you hit that indicator. So the tick box will code that, and then down here you've actually just got the drop down, and those are the different asthma codes that will add them to the asthma register. So again, for this patient, we don't need to do it because they've already got the diagnosis. But if they didn't and you were diagnosing them, you can use this page to make sure you're coding them with the correct code, and it gives you the guidance on what you need to code to get that in the first place. Once you've done it, you probably won't need to go back to that page. The review page is probably more what most people are going to be using here. And again, it's the same across the board, across all the chronic disease templates. We can do our review here. Now, again, red stars are QOF. So if you're getting your red stars, you are capturing everything for QOF. So at a glance, I know that the review code needs to be added for the review for QOF. We need to record smoking if it hasn't been already. Again, remember on the right-hand side, you can see when it was last coded. In the case of this, 2024. So I definitely need to do it again. We need to do an ACT score. We need to do exacerbations in the last year. We need to do inhaler technique and care plan. Those are our key QOF codes, and we would capture our reviews for QOF. But everything else is best practice. It's nice guidance. It's kind of like doing that perfect consultation. So as you go down, we can start coding all of this. Do they smoke? But then you've got things like, do they smoke an e-cigarette? Does it affect them at day, at night, or when they're doing activities? Are there any triggers? So you've all got the ability to code all of that. Again, it depends on the patient and what they're telling you, but you've got all of that information in one screen. And the other thing to say is a lot of these is, for example, where you've got your ACT score, we know those are questions that we have to ask them, but I might not know what those questions are. You probably do if you're an asthma nurse, but you might not. But if you press the button to the right where it says ACT score, it will basically have the questions and it will score it for you. So you've always got the resource. We could, again, just basically answer all of these. And as you can see, as I go along, it's scoring that. So now I've got a score of 25, which is that it's under control. And that would code that onto the notes. I think the way to think about all of our templates is you've basically got the drop down to get the code, and then to the right there is always a button that will take you somewhere else if you need to record more information about that thing. So yeah, all of these got the codes, and then we can see down here is where we've got medication. We've got our asthma formulary again, which I showed you, but it might be as part of the review we want to change what medication they're on, so we can click the asthma formulary, and the formularies are embedded in pretty much every single template. There it is again, and then we could basically go, let's look at the nice guidance, and I want to give a low dose mart, and it shows me what's what, how much they cost, and remember it does grey out if you've got it localized as well. So again, all of that, even if you're not a prescriber, that's useful because you can see what would be given in which instance. And then other things as well, inhaler technique, button to the right, there's a template on here with some really cool resources that enable us to, look at the inhaler videos. So, if we're doing that review, we can say to them, well, actually, let's, I'm going to send you a link to this video which shows you how to use that inhaler, and we can just copy and paste that into AccuRx. I don't have AccuRx, but if you do, just copy and paste it as you normally would, or you can use SystmOne to send that. But again, all those resources at your fingertips to see if you have to go looking for it. And then we even have the care plans. So again, we know we need to code a care plan, but the buttons to the right, you know, I could just use the Asthma UK one. So if I click Asthma UK, and then just go right now, my Word might take a second to load, sometimes it does, but this will load our asthma review, asthma care plan from Asthma UK, and it will just merge the patient's details and things as well. So again, you're not having to do that from scratch. You've got the code and the button to then do it. So there we go, look, adult asthma action plan. It's merged the patient's name and again, you know, what triggers it. So any information that's currently in the record, it's going to put it through for them as well. And then we can just save that as we normally would into the patient record. So yeah, again, I hope that kind of makes sense. But again, that's just a really, really good tool to use to make sure that the reviews are kind of being done. Now, I won't do every tab, but you know, there's like an exacerbation tab. So if it's more that the patient keeps getting, their asthma keeps coming back and it's worse and worse, we could run through this, you know, are they breathless? What findings are there? And then we can tick, you know, is it mild, moderate, severe, or life-threatening? And the good thing about these is whatever I tick here will light up the management. So it could be that, you know, the patient it's moderate asthma. So then it basically tells us what to do. Advise them to use a reliever inhaler. Let's give them some oral steroid therapy, or maybe we'll give some antibiotics if there's bacterial infection. So it's giving me the response depending on why they've come in. So it's actively, you know, showing you what needs to be done off the back of what they've presented with, which is again really useful. And again, it's all based on kind of nice guidance and what should be done. Again, they kind of make sense once you start using these templates, because you can kind of go through and it tells you, you know, that it's got like teaching just like this. It's very much, you know, you go through, it's like, okay, we're ticking the box. It's telling you on the template, so they're very easy to use. It's just knowing what's there. But don't be kind of scared to kind of play with them and that sort of thing. Now, I just come out of the template. I'm just going to go back to the asthma template very quickly and go to the review page. This is for one thing. This is a useful tool as well, maybe more for admin staff than, but I think this is useful for a lot of people. On all of our chronic disease templates, there will be, and I've just gone to the review page, but I think it's on some of the others, but on the review page, in the bottom right, you'll have a red star and a yellow star. The red star on that template will take us to the QOF codes and the QOF rules for this particular condition and nothing else. So it gets rid of all the other noise, the other best practice stuff that we would still good to do. But if I just want to know what's the indicators again for asthma, what do I need to code? If I click the red star, it opens up my asthma, and we can see that QOF 2526 asthma. And what it's doing is it's basically telling me what the indicators are, what the indicators are looking for, codes to code those things. Again, all of that's on the main template. You don't have to use this to code it. It was more just if you wanted to see what's been done. So, and then we know that the AST, you know, 012, it's the test on diagnosis, and it tells me the time frame that needs to be done as well. So it's giving me the rules and the ability to code it there if you wanted to. As I say, if you're coding it on the main template, you don't need to code it on here. It's just more there if you did want to. Asthma is quite an easy one, but I'm just going to cancel that. What I'm going to do now is I'm going to click on the D for diabetes, and you'll see how, I'm not going to go through this in the same detail, but it's the same thing. That you've got your home page, you've got, the only difference here is the reviews over 2 pages, because you have to do quite a bit more codes on a diabetes review. So you got assessment and then plan, but again, they kind of flow quite nicely. But this allows me to kind of tick all of these things. And but can you see down here again, we've got the red star as well. So if I click the red star on this one, it just shows me what the diabetes indicators are and nothing else. So here we get QOF 2025-26 diabetes, a few more indicators on here. So, you know, the DM006 on an ACE or ARB, or foot screening done. But again, I always use this, one of my examples when I do like, it's a bit confused with, we have people come into the support desk and they might say, oh, I've recorded a blood pressure of 136/86, but the diabetes indicator is not being cleared. If you come to this template, it tells us why. So it says what it's looking for. So it'd be like someone under 79 whose last blood pressure was 140, less than 140/90. the last 12 months, but then it's brackets, the home blood pressure reading was 135/85. So I know we've had instances where they've said, well, I put it as 136/86, and then it turned out they put it as a home blood pressure reading rather than a blood reading, and because it's the home, it has to be there. So rules are dated elsewhere, but this template is a really good place to just what are those rules again, and then you can click here and I can see, have we captured it? So again, I think it's a really, especially this time of year, this is a really good place to go, because the other thing is at the bottom there's the personalized care adjustment code. So we've got, it might be if this patient's just unsuitable for QOF, then we're not going to get them in. I can't remember what the code is. I mean, you probably know these off the back, but we can just code it here like informed dissent or patient unsuitable, and that would then take them off. So again, just a really useful tool that you can use. It's probably worth knowing as well with those, you can get some in there. Another way to get them is if I literally went F12, if I typed QOF and hit return, they are all on there, look. So you can add them to your F12 favorites list as well. It's completely up to you. There's multiple ways of getting there. Do whatever you kind of find the most useful. So again, I hope that makes sense. Do put anything in the Q&A if there's any queries or anything. I appreciate I'm not going to get to show everything today. I want to show you a couple other things with regards to templates. Then I'll dive into the reports as well, so you can see what they look like. We do have a reception admin template, which might be useful as well for people to use. Again, what I'd probably do is if you go F12 and literally, I think I did it at the start, didn't I? If I type reception and click search, then we've got our reception and administration template. And if I double click, then again, have a play with this. We do a separate session where we go into more detail on what's on here. This again, today is just more where you find in what, it's an introduction to what's there. But this has loads of links. Again, there's a lot on here, and all of these are separate templates. But these boxes at the top allow us to put free text into the patient record. Now, I appreciate not every practice does that. They might have other ways and means. I'm not here to say do it this way. It's more just knowing this exists. But what it's quite nice is, if it's a telephone and I literally just called the patient, there was no answer, I could write in that box what I did. Or if I click the button to the right of it, I could say, telephoned but no answer, message left on answer machine. Click OK, couple of clicks, that's in. If I click OK again, that has now been put onto the journal. And if I show you what the journal looks like now, then we can see it sat on the journal. And if the patient calls back later on and I'm on lunch, someone else takes the call, they can quite clearly see that I took a message and what message I took. So it's just a nice bit of housekeeping. As I say, you might have other ways and means of recording this. Please don't, if you don't want to do it that way, you don't have to, but there's some useful stuff on the reception admin template. So again, if I go F12, double click reception admin because it's already there. So that was adding, and all of those free texts kind of flow the same way. You've then got the link section here. All of those buttons take you to another template. Now, again, purpose of this, just to show you this exists, we do another session on this, but have a play. There are some useful report templates on here. So for example, like Med3 request, if you're logging a Med3 request on the front desk and you want to gather the information, that will allow you to do that. We've got like a chaperone template, which literally allows us to say, I chaperone the patient, and it's literally just you wouldn't even need me to show you. It's so easy to kind of use. One I will show you here is you've got your lab and radiology results here. This one's really good if you ever get results come in from the labs and they they haven't come down the link yet. So they call out, the labs call up, say, we've got an urgent result. Can you please let the GP know? Everyone seems to record this differently. What you could do is use this lab and radiology results template, because what we could do is we could literally, I might be on the phone, I'm just working reception, I'm not, how do you spell that again, that sort of thing, but we can just, I don't have to write it all out. These numbers probably do not correlate whatsoever to these things, so do ignore it, but we could fill out whatever they're telling me. I could record where the results came from, hospital. Have I checked and read them back? Yes, I have. Have I told the clinician? Yes, I have. And then I could task the GP to say, urgent results, can you check the patient's journal? Or I could I could instant message him, or I could put something on a certain doctor's appointment screen if they're the duty doctor, however it works at your practice. And then again, if I click OK on that, that would then show up on the journal like that. So again, it's nice, clear, concise, accurate data, and it's safer than writing on a bit of paper and losing it. So again, just useful kind of useful ways to kind of do this. And I'll just go back to reception one more time. So yeah, so that was back on the reception template. That was that template there. But you've got other things. Again, have a play. We did do another session. I don't want to spend too long on this, but again, that is a good place to start. If you work on reception admin, get that on your F12 favorites list, have a play, and then we can, I say we do another session on that anyway, where we dive into kind of all the options on that one. Yeah, I think I might have to dive in because I'm conscious of time, and it's a kind of lots of kind of different bits and bobs. One other thing, actually, I talked about the QoF. Sorry, one other thing is we've got a template for your local enhanced services as well. So again, you can F12 it, and if you typed the name of where you are, like your ICB, you would find it with a yellow star. Another way would be if I go back to the asthma template. If you remember, if I go to the review tab, we talked about the red star down there that just shows us our QoF codes and nothing else. The yellow star will launch the local contracts template for your area that you're in. So again, if I click it for here, this is sometimes, we might not, I think we've built it for most areas now, but it's always just worth. So this is the BSW, because this is like the Bath kind of Wiltshire area. So local commission services. This would come up with whatever area you're in, so you don't have to worry about it. It would know where you are. So in the case of this, it's the BSW one, and then what you've got here is all of the different areas that we can claim for. So if I go to ECG, and it's literally telling me what I'm getting paid on. So ECG is done and procedure generated from secondary care, or ECG done and procedure not generated from secondary care, and then you've actually got the codes that the reports are looking for there. So a really good place. What are the local codes and nothing else? And that is on all of those. You've got that yellow star, and you can access that template from there. You do not need to, if you've coded those two things on the ECG template, you do not need to code them here as well. But this is a good place to go if you just want to see what those codes are, and really good for data checking as well. So if you need to go back and data check anything, you can use this template and maybe retrospectively add those codes because they put the wrong code on. So it's just good for your data checking. And then a lot of this would then be displayed on Ardens Manager, which we do on another session. But it's just, again, we do have more in-depth sessions on this. I just, again, wanted you to know that the yellow star those local contract templates are there. And again, look, if I was to F12 and go BSW and hit return, it's not going to come out of, is it? Because it was called something else. I can't remember what it's called. Another way to do it then, auto consultation. And if you go on auto consultations to Ardens contracts, you've got a link to all of your local contracts on there where you can access all of them. So you can do that, or press the yellow star on any of the templates, and it will take you straight to that template. Right, for the last kind of 10 minutes then, I'm just going to dive into the reports and just show you some of the reports that exist as well. I mean, I've barely scratched the surface, but there's a lot you can, I think the idea here is how to get to them, what they look like, and then the more you use them, the more it will kind of make sense. So not only do we do the templates, but if I go up to reporting and then go to clinical reporting, hopefully loading here. So you're probably, everyone that runs reports, you're probably all used to this screen. So you got, my reports, local reports, but then you should all have access to the Ardens Limited folder. And in there, an A to Z list of all sorts of things. Now, again, we do another session on all of this. So it's more just knowing that's there. Stuff to think about. We've divided them up. So you've got these conditions folders, which starts from conditions cancer and goes down to conditions women's health. These allow you to look at just clinical data around those different disease areas. So just very quickly, if I put up the respiratory one, there are subfolders in here which will show us things like alerts, and this will be things that, asthma patients, that's quite a good one that I've highlighted. It's saying these patients, you might want to do a review as they've had 6 or more of the single acting inhalers issued to them in the last 6 months, but they've not had an asthma review in that time. So a really good clinical, say, give that to the asthma nurse. Should we be looking at these 34 patients because they're, they've had 6 or more, why are they having so much? What's going on? So you kind of be proactive with a lot of those reports. I say that's the respiratory folder. If you went into any of the other conditions folders, cancer, dermatitis, any of those, there will be similar searches around those areas. they all have this case finders reports. These are really good in that they will identify patients that are currently not on your registers, but maybe they should be. So again, because I'm in the respiratory folder, just because it makes the most sense, it's the easiest to kind of demonstrate in this really. That top one there that I've got highlighted, it says question mark asthma or COPD as 3 or more inhalers in the last year. And it's basically, again, I've got 62 patients who have all been prescribed 3 or more inhalers. Not one of them has a diagnosis of asthma or COPD. So again, we might want to start looking at those and go, well, what's going on? Why are they on inhalers? Should we not be getting them in and diagnosing them? Or have they got something going on? And again, it just allows you to identify those. But a really good kind of keeping the data up to date, and if you get them on the register, then it's more money next year for your reviews, etc., because your prevalence goes up. So again, really useful reports, and again, they're all in those conditions folders. I'm just showing you the ones for respiratory. And again, performance indicators is quite good in the conditions folders, because all of these will just show you who's had what done or not done. So again, can you see I highlighted all of those? It's basically saying, you know, these patients asthma, but they've not had a care plan coded or an ACT score coded, or no inhaler technique. So, you know, they might have not had any of it done, but there might be patients in there who actually had everything done, but for some reason the inhaler technique wasn't coded, or, you know, the ACT score wasn't put on correctly. So it's missing, therefore we're missing it from QOF. So again, you can just look at those as a different means of identifying patients that might need work doing. And again, I'm showing you that in the respiratory folder, but it's the same across all of them. So again, just some useful stuff in there. Again, you know, do have a play in that. You've got the contracts folders. So you'll notice it's got 24, 25, but it starts there. So you've got 25, 26. Again, I won't go through all of them now because we do a separate session, but just showing you stuff that's good to know from now. The contracts 25, 26, you've got this one, which is enhanced services and vaccinations and IMS. So this is basically like your CQRS stuff. And what we've got in here is we've got current month and previous month. So we don't rebuild the CQRS reports or anything like that. Like, that is still extracted. We're not trying to replace that. But what these reports allow you to do is just to look to make sure that you are claiming for the right patients and you're not missing any. So where are we now? So it's the 10th, so it's probably the last day. So let's say from now on for the rest of the month, if you went to current month not predicted to be an extract, it's basically going to show you any patients that might have had the first, second, or third dose of those, or that booster, or that first dose, or, you know, you can see how it's separated. But let's just say you had one patient sat there. What that's doing is it's saying that someone's coded that they've had the third dose of that, but because they're in this not predicted to be an extract report, for some reason, the business rules on CQRS aren't picking that patient up. They're not in the CQRS extract. Now, the reasoning why, you'd have to go and find out, and there could be myriad number of reasons, but at least you can look at that and go, oh, is it because they're a new patient, and even though that was their third dose, we've not actually recorded the first and second dose yet. And therefore, if that was the case, CQRS just sees that as the first one, even though it's the third, and we'll try and pay you for the first, not the third. Also, I mean, that's one example. And again, it's hard without diving in, but these reports just make sure, why are we not getting paid for that person? Oh, it's because of that. Let's do a manual claim, or let's make an adjustment now before the claims get sent off at the end of the month. So really good just to keep on top of. And then below it, you've got predicted to be an extract, which is basically saying this is who you're going to get paid for. But again, it might be worth checking those, because maybe some patients have the travel, had it for travel, but they're getting picked up, or that sort of stuff. So again, it allows you to dive in and work out, should I be getting paid for them? And if I'm not getting paid for them, why? So not predicted, they're not in the extract. Predicted, they are. And then previous month is now looking at January's. So, that would be useful, but they're probably being all done now for you guys, but it rolls over like that. So again, just a good one to focus on. And then we've got other things. I didn't really touch on it, but we do have down here these LTC folders. We have our own recall process, and this allows you to identify patients at your practice that have a long-term condition But rather than sending someone who's got 5 different conditions, 5 separate invites throughout the year, if you use this process, and you can either do it off QOF or QOF and best practice conditions, so you've got 2 choices. But again, we do separate web, we've got recordings for this, and well, and I'll give you the links at the end. But what this does is essentially in here, recall for first invite, these essentially identify all of your patients, say born in April, because this is March for April, I should say we're going to start next year, and who have one of those conditions, a QOF and best practice condition, and I can use that report to basically bulk send them all an invite, and they only get 1 invite rather than 5 separate ones. And then we can code it, which then moves them on to a second invite after 3 weeks, and we can send another invite and code it, and then that moves them to a third invite. We've even got separate searches for asthma only. So it might be that actually these guys only have asthma and nothing else. Let's send them a questionnaire, and we can sort them out that way. So we give you that choice. And there's a template that works off the back of that basically shows you exactly what bloods are needed and what's missing for each patient. So it kind of collates everything into one template, which is again really, really useful. Again, we do separate training for this, and there is a separate webinar. It's more just FYI. This is here. If it's something you're interested in, I'll share links at the end and you can kind of dive into it more. But again, it's just that kind of overview, but we do that. And just a few other bits. If I go down to the vaccinations folder and open that one up, we have, and it's always the last folder, we build all of your reports for the various vaccinations you would ever give. So we've got your COVID, and I think we are building the spring ones, so they'll be there soon. I'm sure we'll do a webinar over that as well. We've got the childhood vaccinations, flu, and flu and COVID, joint, HPV, everything, MMR, pertussis, pneumococcal, RSV, it's all in there. But essentially, and the childhood ones we've just built as well, what you can do here is they all flow the same way. So if you went here, we've basically got reports, invite is due now. So that will show you everyone at your practice that is due their 8-week immunizations now. And then everyone that's due their 12-week, 16-week, 12-month, the 18-month ones, which are obviously new, and 3 or 4 months. And by using those, you can then use our reports, invite, code them, and then it moves them on to like a second and third invite. So we've got all sorts of recall suites for all of those things. So you don't need to be building them. You know, when flu, I'm sure come summer, we'll be doing a webinar on the flu reports for next year, because we will build them all to spec. And say COVID's the next one, the spring ones are coming, and I'm sure we'll probably do a webinar to cover those off, and we'll go through, you know, these folders here. But again, it would look very similar. You'd go to the invites and you'd basically run those off to invite those patients in for their COVID jabs. So we will make sure all of that's built to the spec. So all you have to do is run them and invite them. So again, that's all in that vaccinations folder as well. I think I might leave it there. I appreciate it's a lot and I'm kind of touching all bases, but it's just more an overview of what's there so you can go away and have a play. Before I go back to my slides, I'm just going to go back to my patient. So on every single template, I'll just go to the doctor's bag because that's where I started. On every single template, in the top right where it says Ardens, there is a link underneath that says help and feedback. If you click that link, it will open up our help files, basically telling you how to use the template that you're on. And these are searchable as well, so you can use these to search for anything you like. For some reason my internet's now decided to be really slow, and I think there's videos on some of these things, and there's recorded webinars. I am going to bring up a QR code in a minute anyway. There you go, look, general consultation, and it basically just talks you through what that template's doing, and it's basically what I covered but written down, so it's like your guide. So every template will have that help and feedback, and it'll be contextual, so it usually takes you to the help file, the template you're on, which is really useful, just worth knowing. And when you're in there as well, on our web, on the support guide, there is the contact us button at the top, and our lovely support team, you can contact them, or you might want to contact training to book extra training. Training's free, I should say that. So if you want training for your practice on any of these kind of elements of this, then I don't know why everyone's being so slow today on my computer, but up a form that you can fill out and kind of send off to us. So there you go. Look, so it can be basically, feedback or help or training, and then basically that will send off and then they'll get back to you. So there's always help available on there. Right, let me bring up my slides then. So just a few kind of what we kind of covered off. So just kind of talking about the awareness of those resources. Kind of went through the where you're finding the templates. Talked about the orange arrow if you look at referral forms, if that's relevant for your area, and then kind of like the like those local the QOF templates as well, and the LCS templates, and then looking at where those reports are as well. In the clinical reporting. So we kind of touched on all the bases, a lot to touch on. I'll touch those bases, and just a few kind of key learning points there. But obviously, using our templates ensures that you're actually collecting that data, and obviously then the reports feed off of that. I mean, the reports feed off of the code anyway. If you didn't use an Ardens template and you still coded the correct code, the reports are still going to work. But obviously, it just enables that, and then you kind of got these patient status, these icons telling us what's going on. You can access the resources from there, and then don't forget his reports you can use for recalling and looking at what's happened, etc. So to say there's a lot there, but if you've got an idea of kind of where to go, and a lot of Ardens is playing with it, and you learn from playing really. So I'm going to leave that on there for you. If you scan that, that will take you to our main training and support pages, and you can go on and basically there's loads of links and everything on there that you can do if you want to put training everything. We've got our Ardens Academy, which is like online kind of resource of like interactive quizzes, and it dives into all of this in more detail. So this is very much kind of like high level. This is what we provide. There is lots of more in-depth training and resources. Now you've done this bit. So this is like the first stage, but there's loads more. And training's free, so feel free to book it. But that's about it. Thanks for your time. If you've got any questions, I'm happy to hang around, by the way. I realise it's 2 o'clock now. But if you do have any questions, whack it in the Q&A. I'm happy to answer them. If not, thank you. I hope it was useful. I know it was a lot, but hopefully it's nice little overview, and we'll see you for the next one. Thank you very much.